Casey Farmer here again with another roll call training for you. I'm going to try to squeeze one in here in about 10 minutes, and this one's going to cover hand injuries. Doesn't sound that important, but hand injuries are one of the major things that we're concerned with when we go on EMS runs because they can be so debilitating long term for a patient. So we'll get into this, and if you've got questions, I'm going to encourage you to get into your EMD and see what it runs you through with questions and stuff, and then kind of compare them to what we cover here today. As always, at the end of the video, if you got questions or something, let me know, and I'll try to get clarifications. Why this matters to us. Hands are critical functions. They're very time sensitive. They hurt a lot. They cause the patient not only physical pain but also emotional pain. So that's important. We want to optimize our response with these. And then we look at that life versus limb. Yeah, most people aren't going to die from a hand injury, but we want to look at that. How's this going to affect their life? Back to the optimizing response real quick. Don't be surprised if we don't ask for a helicopter or put a helicopter on standby for a hand injury, because they're so sensitive with time. We might utilize a helicopter just for a simple hand injury or something that seems to be simple. Really, the place that these people are going to go is to Riverside. So depending on what department in the county, Riverside's a pretty good drive. So we might use air medical on hand injuries, even if it's not a life threat. So just remember, hands are very complex. You've got bones, joints, tendons, nerve, blood vessels, arteries, and veins. You got soft tissue damage that you can have. Again, you have the bones that you can have breaks and stuff. So, this is all important for us. Got to make sure that you're passing this information on, because that plays a lot into our decision making. So you got different types of hand injuries: lacerations, avulsions. An avulsion maybe is a new term for some of you. An avulsion is when the skin's actually tore away from skin and muscle is tore away from a bone, and this is very common in fingers. Think of a ring getting caught on something and degloving the finger. That's an avulsion. Fractures, dislocations. Fractures in a hand can be very hard to diagnose. So that's always going to be a trip to the emergency room. Crush injuries. We look at crush injuries not only as a physical damage, but it depends on how long the hand has been crushed. That plays a role in many different decisions that we have to make also. Amputations, we'll talk about those here in a minute, but amputation is a complete removal of fingers, hand, lower extremity. So you got to make sure that you are relaying that information to us. And then we get into burns. Burns are huge for hands. If one hand is burnt, then that's an automatic trip to a burn center because they are so vital. So key information to gather. What's the mechanism injury? How did this hand injury happen? Trying to time this, I know we're a little bit past the 4th, but hand injuries around the 4th of July, they uptick a lot because people aren't real smart with fireworks. Bleeding, you can have a lot of bleeding from a hand. Remember, there is a lot of arteries actually in the hand that's trying to supply all these nerves for our sensation and stuff. Deformity, loss of function, amputated parts, that's very important. And then some of the care for that. Then there can be associated injuries with hands. Does it go up into the arm? Where was the hand when it was injured? Do we have other injuries that we have to worry about? And then how's the patient doing? A lot of times we have patients that pass out because of hand injuries. It's not necessarily a cardiac issue or something like that. They just can't handle the pain from a hand injury. So bleeding control, this should all be, I'd assume, in your EMD protocols. Direct pressure, raise the hand above the head or above the heart. For a hand injury, most generally we don't need to do tourniquets. But if we're not able to control the bleeding, then a tourniquet can be appropriate. Remember, we're still going to put a tourniquet up high. Again, refer to your EMD. Protect injury, keep it clean, keep it dry, put bandages on it. Amputated parts, this is where things can be, I don't want to say controversial, but there's a lot of different opinions on those. The biggest thing is locate the amputated part, wrap it in something that's clean. Don't want to necessarily wrap it in an old sweatshirt. We want to try to get a clean blanket or a clean cloth to keep it as sterile and as clean as we can. Put it in a bag, a bread sack or something like that. Then you can put it in water. You don't want the body part actually touching the ice. If you're going to put it in ice water or ice, you want to have a little bit of a buffer because it can cause freezing of the skin tissue, and then that's a bigger problem. They can't do anything with frozen tissue. So make sure that it it is not directly against ice. And then we want to make sure that we get the part to the hospital with the patient. There has been cases that we've had people that's amputated a part. Once we extricate them, we get them on the way to the hospital. If the part is still pinned, I've taken amputated parts to the hospital after we've sent the patient, just to get the patient there and get them stabilized. Remember, kids are a little bit different. This has a whole different issue with kids, long term and short term. Industrial accidents. Make sure that you're getting us the information from an industrial accident. Was it crushed? Was it pinned? Was it a saw? How did the injury occur? And also, sometimes then we have to involve OSHA and places like that. That's going to want some information. Electrical injuries and chemical burns. This is a big thing for us to know. An electrical injury to a hand, we have to worry about where did the electricity go out, or is the reason the hand's not attached anymore because that's where the electricity went out. So finding out that information is very important. And then we also have to worry about cardiac things. Chemical burns on a hand, these are pretty common. Most generally, you're going to see just flush with copious amounts of water to get that off. There's very few things actually out there that they tell you not to use water on. So just some takeaway, information is power, not only for you guys, but also for us. Make sure you get as detailed as possible. While one of you is dispatching, make sure that you're going down your EMD list of getting information for us. Make sure bleeding control is a priority. What needs to be stopped first? If we've got a femoral artery bleeding and a hand injury, we want to concentrate on that femoral artery, not necessarily on the hand. But then the hand also is important. Make sure you handle amputated parts carefully. Make sure that you're describing to the person that's on the phone, hey, put it in some ice, but make sure that it's wrapped in something. Make sure that's in a plastic bag. Reassure and support the caller and the patient. And remember, getting us there is very important. And then also we're going to probably utilize could utilize Air Medical to get them places. So again, if you got questions or problems, let me know. We'll figure them out. I appreciate everything that you guys do for us. And if you need anything, let me know.